Susan Hapke, and this is my professional biography for my baccalaureate program graduation with Lamar University. I've been a registered nurse for over 30 years, working in several disciplines, mainly telephonic, such as telephone triage, medical advice, and education as far as wellness and disease management. I'm currently a telephonic case manager for the Medicare population, which I really love, and I do have the case manager certification or CCM credential. I've been married for 23 years. We do have a 22-year-old daughter and a chocolate lab. My hobbies include my family, photography, and reading. I'm also a member of the Phi Kappa Phi and hold a 4.0 in my nursing classes. The baccalaureate degree student learning outcomes were very interesting to review and look to see where I actually completed the requirements in the various constructs of the program. For number one, Humanity and Society, I met that through coursework completed in Nursing 4321 and Nursing 4550 with Dr. Knight. I learned about the various nursing theorists, which was something I hadn't previously been aware of, except for Florence Nightingale, and I wrote my first formal APA paper. I chose Dr. Imogene King as my theorist, as her theory of goal attainment applied to my role as a case manager. We learned about global health toward gaining a better understanding of our professional role in the world and created a clinical application PowerPoint as one of the assignments. I chose making a presentation on the Association of Public Health Nurses, and as being a nurse in a global nursing organization like that I might like to be a member of in the future. I met this outcome at 97%. The second construct in the student learning outcomes is the lifespan health curriculum. And the first part of that is supporting patients and clients in preventing disease, maintaining wellness, promoting and restoring health and dignity, advocating for death with dignity. I met this through the coursework completed in the Compromised Health States class via multiple assignments, discussion board posts, and quizzes. I found those quizzes to be rather challenging, probably because I'm mostly I don't do any direct care, so it was a really great way for me to strengthen my clinical knowledge. I learned so much since I actually went to nursing school many years ago for my ADN. And this construct outcome was also met through the online shadow health assessments and the dynamic discussion boards, posts that we had amongst ourselves and with the fellow students there in that class with Dr. Long. It was a wonderful group, and it was very interesting. We also did a Healthy People activity, which was fun to do, and it was a great way to meet this outcome, which I feel I met at 94%. The other piece of the lifespan health continuum construct for the student learning outcomes is number 3. And this outcome was met by the Compromised Health States with Dr. Leanne Chisholm, again, where we were required to read a patient memoir and reflect on aspects from the memoir in the practicum assignment reflections 1 through 4. I chose to read the autobiography of Kyle Garlett in Heart of Iron, My Journey from Transplant Recipient to Ironman Triathlete. Additionally, our textbook for the class, Medical Surgical Nursing, Patient-Centered Collaborative Care, was extremely helpful. And I still refer to those now. I kept them along with my community health books and many others because they're just really good textbooks. Additionally, the practicum reflections 1 through 4 involved sharing in APA assignment format the ongoing interview, creation of care planning, and patient teaching to a patient of my choosing with conditions similar to the one in the book. And these assignments were to include evidence-based research, as well as involve active listening to understand what the patient's personal preferences were that I was interviewing regarding treatment approaches for the conditions that he was going through, in a way of helping to help him decide what his choices were. He's a very elderly patient as far as how to treat the conditions that he had, which were also very serious, on the lines of Kyle Garlett. And this person had heart failure, aortic valve stenosis, as well as significant coronary artery disease. Opportunity was provided for another service activity of interviewing another patient in my community with a compromised health state. And the person that I assisted in this regard has severe asthma and allergies, so I provided her multiple resources and a lot of practical self-helps and just positive support, and made a PowerPoint presentation sharing this experience and those resources as well. I met this outcome at about 95%. Student learning outcome number 4 is the evidence-based practice and clinical reasoning construct. And this learning outcome was met through coursework completed in the Nursing Inquiry and Evidence-Based Practice course with Dr. Nancy McAfee and Dr. Cynthia Pipkins. In this class, we learned all about the types of research and the steps of doing research, as well as how to determine the reliability and validity of particular pieces of research and articles. We utilized a collaborative small group approach, forming a team to take apart articles that we were looking at and really use our critical thinking skills to see what type of research that was performed on these articles, whether they were valid as far as something that we would want to use in our own practice, as far as incorporating them into our own skill set and as a foundation for patient care. Additionally, the ethics of obtaining informed consent were explored. I met this outcome at 92%. The student learning outcome number 5 is patient-client-centered care. This outcome was achieved through the Nursing 4580 capstone course, which was just completed, the first module this past month, in the study of events surrounding the tragic death of Lewis Blackman and near disaster of baby William, wherein collaboration with patient and clients and members of the interprofessional and intraprofessional healthcare team would have prevented both events. We have interesting and helpful discussions, and I'm grateful for this learning opportunity to enrich and deepen my nursing skills and critical thinking ability. During the Care of Communities course, I studied the community as client and found this a most interesting course. There are so many factors surrounding a person or within a community which have direct or indirect consequences, effects of their work, school, neighborhood environment, affecting their health or putting them or their families at risk. I devised care plans to address specific needs of a vulnerable population in the community, a specific aggregate. I chose the elderly in California, where I grew up, and I used the windshield survey, which was a key project toward this end of meeting this outcome, which I met at 97% so far. The student learning outcome number 6 is the professional roles construct. And the first part was met through completion of the online theory in nursing 4321, and then the leadership course, Nursing 4550. So in Nursing 4321, we discussed the differentiated essential competencies, or DECs, of the Texas Board of Nursing, and applied it to the scenario of handling a patient fall. According to the Texas Board of Nursing, baccalaureate education brings with it the tools of strong critical thinking and problem-solving skills. Pertinent facts related to this are that the course content topics of community health, nursing research, and courses that provide depth and breadth in the understanding of leadership, management, health promotion, and care of vulnerable groups are required by the Texas Board of Nursing, but these areas of study are generally not learned in the entry levels of RN education, according to the Board of Nursing. Now, in the nursing leadership class, topics included were the role of the professional nurse as a patient safety advocate, healthcare planner, leader, and manager. We also delved into ways to make an impact on a patient care-centered problem in our own roles, and were asked to collaborate with others in our setting for discussing conflict resolution. And then we wrote an APA paper on how to address the problem. I entitled my paper, Facilitating Seamless Patient Care, An Insider's View, as a rather new case manager, and applied my newly learned critical thinking leadership skills in order to solve the chosen problem at my healthcare setting. I met this learning outcome at 97%. The second part of the professional roles construct involves demonstrating professional integrity, effective communication, active inquiry, and service to the community. This outcome was met by all of the nursing courses I took, each in its own way. But the one course that stands out in my mind that encompassed my being able to meet all the components of the outcome was the care of the community class with Dr. Ivo. This was the most awareness-raising course for me. I did not even know what a Superfund site was before this course, nor that there were any near our home. I loved exploring the included subjects of epidemiology, environmental health, and special populations. There were several concepts and tools that I took from the course that I use now and will in the future, especially along the lines of assisting vulnerable populations in practical ways. I chose earthquake preparedness in the elderly and vulnerable, as I mentioned, as my presentation topic, making a preparedness video, topic handouts, and assisted my own parents in getting a full earthquake disaster kit together, being that they do live in California. This course made me realize why I would love to be a volunteer for relief agencies when or before I retire. I feel I met this objective, this outcome, at 95%. My 5-year career plan is to keep my case management credential active by taking the specific eligible continuing education courses to make it so, and to incorporate the skills and critical thinking techniques which I've learned in this BSN program into my present role. And I would also like to begin volunteering with both disaster relief and with palliative care, which I do actually work with right now, but not as a volunteer. Thank you for listening.